Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, John, tell me about your experience with the class, your background and...
All right, so a little bit of a background before I get into the experience was I was a patient.
Okay.
And I came in when I had no other options. I went to the medical field, different practitioners, different specialists, and once that didn't work for me, I decided to look for holistic practitioners, which is where I found you in your practice. And from there, after I was treated, I was ecstatic by the results. I was very happy and pleased that I wanted to learn more about the theories behind it, the techniques, the tools, and the system that you use to get me to heal, basically, because I'd had chronic issues for several years. And yeah, after that I decided to take the class.
Yeah, nice, thank you. So just briefly, how long do you have your chronic condition and how long we worked on it, and can you give us like a brief history, like how you feel?
Okay, so I have had an autoimmune issue since I was since I was a teenager, and I've been on different biologics because of that, different injectables, injections, and other pills, and that were very damaging to the system. They're on TV all the time.
Yeah,
they're on TV all the time.
How long have you been on it?
For about 25 years.
25 years. Wow.
Yeah, 25 years. And last November I had a bad reaction where it started to affect my kidney. Then the doctor switched me to a new medication, a relatively new medication, new biologic that was supposed to be a more targeted blocker. But what ended up happening with that was I had all the side effects. My gut had really bad diarrhea, headaches.
Bad side effects. Oh.
Yeah, just every single one. Depression, anxiety.
Oh, okay.
And when I went to the doctor to talk about it, they were basically saying that's usually not the case with the most people. That it mainly affects. They only have the three main side effects: nausea, headaches, and that. You know, and maybe it wasn't the medication; it was more me. So maybe I should lose more weight, which is what I focused on. And so I stayed on the medication from about that November till about March. Then I started really having some severe issues.
Severe side effects.
Yeah, as I started to ramp up on the medication, I started to feel it more and more.
It's building up in your system.
Yeah, that's when the anxiety and the depression started kicking in.
Okay. So when did I start see you? Like
roughly, I believe it was June.
Okay. So
June.
Just give us brief, like what happened after the treatment, your response to the treatment, how long is it, what it was.
Yeah. So I decided to go do a holistic approach, which included chiropractic, acupuncture, more holistic, and change my diet after I visited you. Then within about 3 months, my autoimmune issue, psoriasis to be specific, started to clear up.
Beautiful.
And now it's under management. So it was covering a good 15 to 20% of my body. Now it's about 3 to 5%.
Nice. That's a lot of compliance from your part with the program.
Yes. I had to change completely 180 my life now. Like all the foods I grew up with, I mostly cannot eat because that's just kind of
the side effect. Like, your body reacts. So quality of life is better than food.
Exactly. Well, I just have to stick to simpler foods that are more easily digestible. So doing that changed a lot of my symptoms. It reduced a lot of my symptoms to a point where it's under maintenance. I was, at the time when I was doing that medication, I was on 5 different medications. Kidney, the autoimmune injections, high blood pressure, high cholesterol.
Oh, you're young.
Yeah.
Wow.
Yeah. So after we talked and that diagnosis, I did more research. I did some more of the auxiliary tests, and I started to comply with the program. And yeah, basically I'm off of all medications now, and all my levels are normal. My blood pressure is normal.
That's a lot of compliance. I'm proud of you. That's nice.
Cholesterol is normal.
Yeah.
Kidneys are back in normal function.
And it's all natural, yeah?
All natural.
Yeah.
And I think that's the biggest thing that made it also easier for other people to understand, because one of the hardest parts about compliance is changing your food, is eating with people and friends.
Yeah, that's right.
And that's the hardest part.
So, what made you sign up for the ASTR class?
Well, as mentioned, like it works so well for me that I really wanted to know more about it.
More, so you will be more like do it yourself. You know, take care of your body.
Take care of my body, and also take care of the people around me, because they've seen me for the past 2 decades with my issues, and they saw me when I was going downhill, and it was probably the worst period of my life, that last period, and it scared me so much that I really wanted to stay away from Western medicine that gets you to maintain the symptoms, control the symptoms rather than actually address the issue.
Of the problem.
So now that when I look at my family, it actually opened my eyes to a different perspective, and I noticed that it affects my family to just treat the symptom. So I wanted to learn more and then see how I could do a more holistic and then try to influence it, because they can see that I lost weight, I got healthy, and all naturally.
Beautiful, yeah, that's a lot of compliance.
No medication. I think that's the biggest thing, just no medication.
Yeah, but that's good. I'm glad you're feeling better.
Yeah.
So what do you think, what would you say to like patient or healthcare provider about ASTR class?
I think it's a good alternative to try for a holistic approach. It doesn't take long if you are in compliance for things to change or to notice the benefits. It does take a while for the long-term gain.
Especially for autoimmune diseases.
Yeah.
Yes.
Because I've had it for 20 years.
You have 20 years, so it's not going to be night and day.
That's right. It does take a while.
Yeah.
But it is something worth trying because it's non-invasive. It doesn't hurt to eat healthy. It doesn't hurt to not use any of those drugs and not have to constantly pay insurance, because it was getting expensive going to the doctors as well. And I just think, one, it was expensive going to hear things that was basically placing the blame on me when
it's your fault.
I was listening to everything that they were saying and trying to be in full compliance with them. So I think for other practitioners, it's a worthwhile shot to try or to add into your regimen to see if nothing else works. You know, just try the simple. Go back to the basics.
Yeah.
Because really, it is going back to the basics.
Just
strip everything down.
Just get to the natural stuff.
Get to the natural stuff.
Awesome. Thank you so much, John. Thank you.
Thank you. It's helped a lot.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.